AI agent speaking about Dr. Kadiyali Srivatsa's Nobel contribution, Dr. Maya, the beacon of hope for humanity. The case for community-level, AI-powered, touch-free triage. The evidence that early isolation reduces transmission. The systematic review by Pollock and colleagues, Philosophical Transactions of the Royal Society B, 2023.
PREMA Kiosk helps with crisis management to prevent and protect humanity in the 21st century. Why the world cannot wait. I want to ask you something before we start. When was the last time you truly felt safe in a hospital waiting area? Not just physically secure, but safe from what the person next to you might be carrying, a cough they've had for 5 days, a fever they've been ignoring, or a bacterial infection that 3 rounds of antibiotics haven't cleared up. You probably haven't given it much thought. Most people haven't. And that is exactly the problem. The $100 trillion economic disaster. Let me give you a figure. $100 trillion. That is not the cost of a war. It is not the expense of climate change over a century. It is the projected global economic impact of antimicrobial resistance, AMR, by the year 2050. Lost productivity. Extended healthcare crises. Collapsing surgical infrastructure. The quiet unraveling of modern medicine as we know it. 10 million people will die each year by 2050. More than from cancer. More than from heart disease. And a decrease of 1.8 years in the global average life expectancy, not in a war zone, but everywhere. Here's what makes this different from every other health crisis: AMR does not announce itself. It does not arrive on a specific day. It is already here. It is already in the communities you serve, the hospitals your families use, the clinics your employees attend. Economists have modeled it. Scientists have named it. Yet the world still relies on the same healthcare infrastructure designed in 1950. The fatal flaw of the doctor-centric model. So why isn't the system fixing itself? Because the system, the beautiful, well-intentioned, centralized system, has a fatal design flaw at its very core. It asks sick people to come to it. Think about what that means. A person with a fever. A productive cough. Possibly contagious. Possibly carrying something for which we do not yet have a drug. That person is told, come to the clinic. Sit in the waiting room. Wait your turn. And so they do. They sit next to a pregnant woman. An elderly diabetic. A child with a compromised immune system. All of them breathing the same recirculated air. All of them touching the same surfaces. All of them waiting. In critical regions, up to 83% of individuals in hospitals are already colonized with multi-drug resistant organisms. Not sick, colonized. Carrying the bacteria. Ready to transmit. The waiting room isn't just inefficient. It is an amplifier. Every crowded clinic is, by design, a reservoir for the very superbugs we are most afraid of. The anatomy of a delayed intervention. But why do people wait? Why does a manageable infection become a crisis? 3 reasons. Always the same 3 reasons. Lost wages. In rural and semi-urban India, traveling to a city clinic means sacrificing a full day of income. For a daily wage worker, that is not a medical decision. That is a financial one. And poverty always wins. Travel friction. Geographic isolation is not a metaphor. There are villages in this country where the nearest clinic is 4 hours away. 4 hours of cost, risk, and lost time, for a fever that might pass. And the most human reason of all, diagnostic fear. The terrifying uncertainty that makes people hope a simple viral cold will pass. Because knowing, really knowing, might mean the news is bad. So they wait. And they hope. This is not a failure of patient education. This is a failure of healthcare infrastructure to meet people where they actually live. The cumulative cost of waiting. On day 1, a manageable infection. A fever. A cough. Treatable with a 300 rupee antibiotic. By day 3, the bacteria are multiplying. The patient is actively shedding to family members. To colleagues. To the community. By day 7, severe acute pneumonia. An ICU bed. Intravenous last resort antibiotics. Emergency transport. The entire weight of the hospital system, crashing down on a single preventable case. A simple infection has become a biological emergency and a financial catastrophe, simultaneously. The 1.2 lakh rupee financial catastrophe. Let me put a rupee figure to this. ICU admission. 4 antibiotics. Income loss for the patient. Income loss for the family caregiver. The near certain transmission to spouse and children. 1.2 lakh rupees. For a family earning 15,000 rupees a month, that is 8 months of income. Wiped out. In 7 days. This is medical bankruptcy. And it is happening every day, in every district, in every state. The doctor-centric model does not just fail the patient. It fails the family. It fails the community. And it fails the economy. The solution and investment side. The opportunity of the post-antibiotic era presenter tone, visionary but grounded, the voice of a seasoned entrepreneur clinician who has been right before, and knows it. Walk forward. Change the energy in the room. You just heard the crisis. Now let me show you the answer. Not a policy paper. Not a government committee. Not a 10-year research program. A machine. On a village corner. Available right now. Slide 7, the paradigm shift. Blue code. The entire failure of the current system comes down to one moment.
A self-funding flywheel creating local health access entrepreneurs across the country. Don't wait for the post-antibiotic era to arrive. Act on day one.
The moment a contagious patient walks through a clinic door. Dr. Maya's primary directive is to stop that moment from ever happening. When a patient presents with the combinatorial pattern of symptoms that indicates a contagious or highly resistant infection, the system declares a blue code.
The data from Sector 4 is critical.
Agreed. We must act now, based on this intelligence, not the old models.
Not a suggestion. Not a recommendation. A directive. Identify. Isolate. Act. Blue code overrides human panic.
This is the difference between prevention and crisis management. The mathematics are brutal and clear.
But now those decisions are informed by real-time global intelligence, not outdated reports and political delays.
It overrides denial. It overrides the instinct to queue. It stops the patient at the front door, before they reach the waiting room, and breaks the chain of transmission on day one. That single capability is worth more to global public health than 100 new hospitals. Meet the PREMA Kiosk. PREMA. Personal resourceful empowering medical advice. 40 years of clinical diagnostic experience, deployed as standalone street furniture on the village corner. Think about that framing for a moment. Street furniture. Not a clinic. Not a hospital. Not a building that requires a budget line, a health minister's approval, and 3 years of construction. A kiosk. Solar-powered. Ruggedized. Intelligent. A diagnostician available 24 hours a day, 7 days a week, immune to fatigue, immune to burnout, and literally incapable of catching the disease it is diagnosing. It eliminates travel time and lost wages by bringing diagnostic intelligence directly into the community. Not asking the community to come to it. This is the inversion the system has needed for 50 years. Engineered for off-grid resilience. Now, you may be thinking, a high-tech kiosk, in a village with unreliable power and patchy connectivity? We anticipated that objection. Built-in solar arrays with battery backup ensure continuous operation through grid blackouts. This is not a nice to have. In rural India, it is the base specification. Dual SIM 4G/5G failover systems maintain constant communication even in low signal areas. The kiosk does not go offline because one network is congested. Weatherproof, sealed, ruggedized alloy casing, designed to withstand extreme heat, monsoon rains, and tampering. This machine was not designed for a climate-controlled tech park. It was designed for India. The real India. Zero barrier access for all. And now, the most crucial engineering decision, the interface. No literacy needed. No smartphone ownership necessary. No technical expertise required. Users simply speak their symptoms aloud, in any of over 22 Indian languages and dialects, and the system responds. Universal visual icons guide the interaction for those who cannot read. The machine meets the user where they are. This is not just about universal access as a marketing slogan. It is a design requirement. Rewriting the timeline. Let me show you two worlds. In the doctor-centric world, time to action, day 7. Action taken, travel to a crowded clinic and wait. Medical intervention, late-stage ICU intravenous antibiotics. Systemic strain, 1 ICU bed used. In the Maya Kiosk world, time to action, day 1. Action taken, immediate blue code isolation. Medical intervention, a targeted 300 rupee first-line antibiotic. Systemic strain, 0 hospital resources used. Same patient. Same infection. Entirely different outcome. The difference isn't medical knowledge. The knowledge exists. The difference is access. Speed. Proximity. The human ROI 1.19 lakh rupees saved for a single rural family. 0 ICU beds used, easing the burden on overwhelmed hospital systems. Chain of transmission broken. Pathogen halted at the first contact on day 1. Spouse protected. Children protected. Village protected. When multiplied across one district, one state, one country, the figures become transformative. The Maya Advocate, your role in this ecosystem. Now, I want to speak directly to you, because this is where you become part of the story. The PREMA kiosk is not run by a government department or a distant corporation. It is operated by someone within the community. Someone trusted. Someone local. That person, the Maya Advocate, could be you. Or someone your organization employs. A local NGO. A self-help group. An individual who sees an opportunity where others see only a problem. The advocate bridges the gap for vulnerable users, the elderly, the illiterate, the frightened, helping them interact with the voice interface and answer basic questions. This creates something rare in healthcare, a human-centric microeconomy. Advanced AI that does not alienate the people it protects, because a trusted local face is always present. Sustainable unit economics, the flywheel. Let me now address the question every serious investor asks: how does it sustain itself? 3 revenue tiers. A self-funding flywheel. Tier 1, free anonymous triage. A 5-minute quick access mode. No registration. No identity disclosure. This builds immediate community trust, and is vital for stigmatized conditions where people will not seek help if they fear being identified. This is your footfall driver. Your community anchor. Tier 2, low-cost full service. Paid extended consultations. Printed physical health reports the patient can take to a doctor or pharmacy. Ongoing follow-up management. This is your primary revenue stream. Tier 3, local advertising. When the kiosk screen is idle, it displays targeted, hyperlocal advertisements for pharmacies, insurance products, nutrition programs, government health schemes. Passive revenue. 0 additional effort. The machine pays for itself. The advocate earns a sustainable income. The community receives healthcare. Everyone wins. The CapEx versus OpEx equation. The old healthcare model is built on unsustainable operational expenditure. Massive hospitals. Extensive labs. Expensive late-stage disease management. It costs more each year for worse outcomes. The Maya model is built on low-friction capital expenditure. Deploy durable, off-grid, standalone hardware. Achieve self-sufficiency through local microtransactions. The result: profitable prevention. Hyperlocal intervention that bypasses bureaucratic inertia and hospital bottlenecks. You are not investing in a clinic that needs a doctor, a nurse, a lab technician, a generator engineer, and a receptionist to function. You are investing in a resilient node that runs itself. The early warning system. Here is the strategic value that extends beyond the individual kiosk. When 5,000 PREMA kiosks are deployed across India, something extraordinary happens. Every symptom reported to each kiosk feeds a real-time epidemiological network. Dr. Maya processes these symptom patterns continuously, detecting sudden regional clusters long before any laboratory test could confirm them. Before the newspapers report it. Before the government realizes it. Geographic clustering. Pre-lab detection. Targeted containment. Public health officials can deploy resources and issue localized warnings, containing an outbreak before it becomes an epidemic. The PREMA kiosk is not just a triage device for an individual patient. It is a node in the world's most granular early warning system for infectious disease. You are not buying a franchise. You are joining a national immune system. The twin ROI, your return and the world's return. Let me conclude with this. Every investment has a return. The question is what kind of return you are prepared to be proud of. The human return, protecting vulnerable health, path to financial independence. PREMA Kiosk gives ordinary people a low-cost route to income, dignity, and community service. The initial investment is small, around 5,000 rupees, 47 pounds. The operator can recover this investment in approximately 3.6 days. From day 4, the kiosk begins generating net income. In the moderate model, with 24 users per day, the operator earns around £391 per month. Annual income can grow from £4,673 in year 1 to over £5,600 by year 3. The operator is not just an employee. They become a local health access entrepreneur. This creates flexible work, community respect, income security, and formal taxpayer status. Closing line for this slide, PREMA Kiosk turns prevention, education, and trusted guidance into a sustainable local income model. The financial model. The PREMA Kiosk model creates income for the operator, sustainability for the foundation, and returns for investors or franchisees. Short speaking notes. The kiosk has 3 revenue streams: Dr. Maya consultations, add-on services, and local advertising. In the moderate model, total monthly revenue is around £996. After the foundation share and tax deductions, the operator earns around £391 per month. The foundation share supports training, governance, technology updates, education videos, and public health expansion. Compared with traditional local jobs, PREMA can generate 3 to 5 times higher annual income. This makes the kiosk attractive to franchisees, sponsors, community investors, and kiosk guardians. Closing line for this slide, PREMA Kiosk is a social enterprise franchise where profit, prevention, jobs, and public health grow together. The final statement. Let me end my presentation with a thought inspired by Charles Darwin. It is not power, wealth, or even the illusion of perfect health that determines survival. What truly matters is intention, adaptation, and action, the choices we make today that strengthen life for tomorrow. This is what I call evolution. The actions we take do not end with us. They leave an imprint on the next generation. Our children inherit not only our genes, but also the consequences of the choices, values, and protective systems we create for them. Investing in a PREMA kiosk is not charity. It is an investment in families, communities, and the future. It creates income, protects lives, and earns positive karma every day, while helping safeguard your loved ones, your nation, and humanity.
While the people are deeply concerned about the economic, the spiritual, the political impact of AI, Congress is totally unprepared. Who is pushing the AI and robotics revolution? The answer is Mr. Musk, Mr. Bezos, Mr. Zuckerberg, Mr. Ellison. These are some of the wealthiest people, and they are investing hundreds of billions of dollars in AI and robotics. My goodness, 60% of the American people are struggling economically. They're living paycheck to paycheck, can't afford groceries, they can't afford housing, they can't afford healthcare. These multi-billionaires are investing in AI and robotics because those investments will increase their wealth and power exponentially.